It's our first federal election since the beginning of a pandemic that's killed more than 6 million people worldwide and counting. But you wouldn't know it from last night's debate, where almost every mention of COVID was about the after effects on the economy and wages.
We need to do more than say thanks very much for everything you did in the pandemic, but now we're going to cut your wages.
Australia is one of the most successful economies to come out of this pandemic.
The debt had doubled before the pandemic.
We turned that a budget round by the time we hit the pandemic.
The leaders may just be reflecting the national mood, which seems to be, hey, we're on the other side of this thing, let's get back to normal, even though that's not what the numbers are telling us.
Record-breaking case numbers continue to climb.
COVID numbers and deaths have spiked.
A record number of COVID cases.
Australia now has the second highest per capita average daily infection rate for a population of more than 1 million people. Experts say as we head into winter, it's going to get worse. When Aussies were asked last year how many deaths they'd find acceptable, 61% said fewer than 100 per year, 25% said fewer than 1,000. So far, we've seen more than 5,000 this year already, and virologists are predicting 13,000 before the year is out. But would we be willing to take the measures needed to get this under control? Or are we more comfortable with this new normal than we thought?
Epidemiologist Professor Nancy Baxter joins us once again. Nancy, 13,000 deaths across the country before the year is out. Does that prediction seem about right to you?
Well, unless something changes dramatically, yes, it sounds right. And that's going to make this one of the most common killers of Australians this year.
So, Nancy, I mean, what is the big fear as we head into another winter? Is it simply that the virus will have more opportunity to spread indoors, or could we be facing more variants?
Yeah, well, what we're seeing is a number of things that are driving increased transmission. One is that we've relaxed all the protections and restrictions, and then we have people going indoors. So we know when you share air that it doesn't circulate well, it increases your chance if someone has COVID in a room, say, of your getting COVID. And then you have waning immunity. So there's waning immunity from our boosters as we get longer and longer from our first doses and from our boosters. You know, our immunity to transmission decreases, as does our immunity from having COVID before. So everyone who got COVID over the Christmas time, who thinks they're kind of over and done with COVID, the sad news is you can get more. We're now facing some new subvariants of Omicron, so more cousins of Omicron that are actually more transmissible and are coming into Australia now. So I don't think we're going to see cases going down, that's for sure. I think we're going to see cases going up quite a bit over the next month or so.
So the numbers are huge, Nancy, in a way that would have been unthinkable like a year ago. Hospitalisations are not out of control, that they're not huge on COVID themselves. And the Chief Health Officer has said we shouldn't actually be focusing on those numbers. We shouldn't be focusing on daily numbers or death rates even, but on what he calls excess deaths, which I gather is a measure of how many COVID or what contribution COVID is making to deaths beyond what would be the average, I guess. Do you think that's the right approach?
Well, you know, looking at excess deaths overall, it's important in terms of understanding trends and what things are impacting on Australians. So it makes sense to look at excess deaths. And when we looked at the first 2 years of the pandemic, you know, we actually had lower deaths than we would expect for a number of reasons. So COVID really wasn't contributing to death in the first 2 years. But, you know, in January, the Australian Bureau of Statistics, when they looked at the data and they reported it in late April, they actually found 22% more deaths in January than expected, and all of them were due to COVID. So we are clearly going to have more deaths than expected this year, and it's going to be because of COVID. But that aside, whether we have excess deaths or not, we certainly worry about heart disease, we worry about deaths from cancer, we worry about deaths from a lot of things, even if it doesn't drive more deaths than expected. Now, we have a new disease that actually is going to be one of the most common killers of Australians this year. We have to worry about it. So we have to worry about the deaths, the excess deaths, the hospitalization, and the cases.
So, Nancy, if for a moment you could imagine that there's no lockdown fatigue or fear fatigue or anything like that, what type of protections would you put in place to combat the numbers that you're anticipating?
So, you know, I think that we may need to think about masks indoors. I think it's unlikely that anyone's going to mandate them, because that, particularly in the political landscape we're in, it will be very difficult for people to do. But certainly I think the workplaces have some responsibility to make sure their workers are protected, and thinking about not forcing people back to work, I think, is really essential, and making sure when people are sick, they have paid leave so that they don't have to come in, or have access to being able to work from home so they won't infect everyone at work. Encouraging people to do that and making sure there's leadership to know that is the expectation versus giving someone a hassle when they don't want to be infecting everyone at work.
Nancy, thanks so much for your time.
Thank you.